the Tooth Be Told podcast. My name is Erica, and this is Brandy.
Hey, guys.
Welcome back to our series on restorative healthcare. So, if this is your first time with us, we are focused on helping the underserved and underprivileged communities, particularly people of color, Black and Brown, with their dental healthcare. Okay,
Yes,
so like I was
absolutely.
saying, we're doing a series on restorative healthcare. So we've done root canals, fillings, and crowns,
Yeah.
and now we're doing bridges today. So, the definition of a bridge is a cemented dental appliance used to replace one or more missing teeth by joining an artificial tooth to crowns or implants. All right, so
Yes.
Brandy, when we're talking about bridges, right? And I spoke on the last episode at the end. I got a bridge, okay? So I don't know what kind I have, but I know there's different types. So please, can you explain to us different types of bridges?
Okay, so
Okay.
there are a few. And so you have your traditional bridge, which is the one we're going to talk more about today. So we'll go into that later. There's also a Maryland bridge, and a Maryland bridge is kind of like let me see how I can explain it. A floating tooth that has wings on it, and the wings are cemented or attached to two adjacent teeth. So the missing tooth, that little floating tooth will sit in there, and the wings will be kind of glued to the teeth directly next door so that it stays there. This one is probably the more conservative of the bridges because you're not removing any tooth structure to place crowns to fill in the space. So that's a Maryland bridge. The other is a cantilever. And the cantilever bridge is a bridge that's supported only on one end. So not really a bridge. Because a bridge spans, if you think of a bridge like the Ben Franklin, two ends span water. And that's the same way a traditional bridge, two teeth span an empty space. But the cantilever is one end and then the artificial tooth and nothing behind it.
That must be what I have because mine, it was like a one space, one tooth. And it was.
Well, okay. So you might have that, but does it join on two ends, one end and one end, and then replacing one tooth? Because that's a traditional bridge. A cantilever has nothing behind it. It
Then
just
that's not it.
hangs.
Then I got
Okay, so that's a
traditional. Then I got
cantilever.
it.
So it's only
Okay.
on one
Okay.
end.
And Maryland, is that Maryland Monroe or Maryland Estate?
Maryland, like the state.
Okay.
Yeah, Maryland, like the state. Good question. And the last bridge is an implant bridge, which I will talk about on the implant episode a little bit more.
Okay. All right. All right. It's good to know, as always. All right. So now, why would someone need a bridge?
Well, okay, the reason is if you're missing one or more teeth, basically.
Okay.
If you're missing a tooth, it's more beneficial if you're missing one tooth. So you can miss two teeth in span, but then it's not as strong, if that makes any sense, as
It
if
does.
you're trying. Okay,
because you got too much space in there, right?
in between, yeah.
Yeah.
So if it's one tooth, it's ideal, but people do have it to span two teeth sometimes. So typically, that's why you would get a bridge to fill in, to replace a missing tooth.
Okay. All right. So now we getting down to nitty gritty and stuff, So I'm going to find out why I got this in my mouth and what's going to happen. All right. So what does the procedure entail? Which obviously I kind of know, but
you kind of have an idea.
Tell the people.
Yes. So for the traditional bridge, because we'll focus on that one, there are two teeth. So we're going to say that we need to replace one tooth. So the tooth in front of the tooth and the tooth behind the tooth, those teeth are reshaped, just like in the crown. When we talked about in the crown video, they are reshaped and prepped to look like little nubs. And then there are crowns made to place on there. The bridge has a little fake tooth in between that's attached on both ends so that it spans the empty space. and
Okay.
that's cemented. So just like in the crown video, you're going to have a local anesthetic. You'll get numb with your Novocaine. There'll be a lot of vibration and water spray. The dentist will use the drill to reshape the tooth, and then an impression will be taken. That impression will be sent off to the dental lab where they will fabricate or make the bridge. Takes about 2 weeks, and then in the meantime, the dentist will make a temporary bridge for you to wear until you get the permanent bridge back.
Remember that. Yes,
So it's
yes,
very similar to a crown, except it's like you're doing two crowns instead of
yes.
one.
Okay.
Um, and then for implants, it'll be a little bit different, and I'll explain that. But remember, just like in the last episode, the teeth a lot of times on a bridge are vital teeth, meaning they are not root canal. They're natural teeth that still have the nerve and blood supply intact. So once that's removed, it cannot be replaced. It's irreversible. And you may have some sensitivity associated with it afterwards. That's
All
part
right.
of the next question, actually, Erica's going to ask.
Okay. Well, yeah. The risk and the benefits, Brandy.
Yeah, so all right, I was
I'm
saying
like, I'm scared. Like, what?
before she asked me. But yeah, so the extreme sensitivity can lead to root canal. You may need to have root canals if they are vital teeth. If the teeth are already root canals, there should be no issue there. There can be gum irritation because now the bridge is covering a portion of the gum tissue. So you have to be able to clean and access underneath it there. So you'll have to use special cleaners like a floss threader or a Proxa brush to get in there to clean because food will get stuck in there. And if you're not cleaning it, it will sit there and it can cause infection. It can cause gingivitis. It can cause periodontitis around those teeth. So you really have to keep it clean. And I don't think they tell patients that enough. It's very
Mm-mm.
important. You got to clean underneath the bridge. You got to access it. You can't just leave it. Otherwise, you could have big problems in the future. You could lose those teeth, and then it's like a waste because it's not, it's not cheap. It's very expensive.
Mm-mm.
Um, like we said before, it's irreversible. You can have reoccurrent cavities or decay on those teeth. The metal can show at the gum line if it is a porcelain fused to metal bridge, which typically the bridges are fused with metal because they're taking on extraordinary biting forces when you're chewing, and that just makes it a lot stronger. Um, and it may need to be replaced in the future.
So you
The
already
benefits, I'm
asked,
sorry,
yeah, go ahead, yeah.
because I ain't get to the benefits.
Okay.
Sorry, aesthetics.
Okay.
So we know it's going to look good. It's going to replace the missing tooth. It's going to provide you support and function, and it'll last you about 5 to 15 years. You can choose the shade, so it can match all of your teeth. So it will look a lot better, and it'll feel much better too. You'll be able to chew and eat better replacing that tooth.
5 to 15 years.
Mm-hmm.
So you'll be
Yeah,
back.
yeah,
You'll be
y'all.
back.
You may
All
be.
right. So
Listen.
I want to know, what was something crazy that happened to you at work this week?
I had a patient yesterday. He was a new patient, and since I've been working by myself lately, well, forever, except for
Ever,
when
ever,
Eileen's
and
there
ever,
2 days a
ever?
week, but forever, ever. Yes. Okay. So I usually when new patients come in, they have their X-rays exam. The cleaning is rescheduled because my schedule's so full. So we had a patient yesterday who literally was refusing to leave the office because he wasn't getting a cleaning. He like, now I'm cleaning other patients and I can hear because I'm not far, but I can hear. And he like, I'm not going anywhere. I'm staying here. She's going to stay late and do my cleaning. So they're like, yeah, she's not going to do that.
No.
Well, somebody better tell her she has to. But she's not going to do that. And he was like, I'm not going nowhere. So Dr. Zabato had to like ask him to leave. He like, we got to call the police. Like, I don't understand. Like, we have other patients. So he goes up front and they rescheduled him for today. So he came in today. I didn't see him. I
I'm about to
didn't
say,
see
did
him.
you see
But
him?
listen,
The good thing the police is right across the street too.
girl, listen. When I tell you,
Listen.
he was as sweet and peachy keen as pie could be to Eileen. And I said, Eileen, I told her
Bad.
what happened. I told her what happened afterwards. But he still
Not
got his teeth. But
bad.
my point is, this happens more often than not. People be snapping out. But he was not finna leave.
He was serious. He wanted his teeth clean because he ain't want no problems. He ain't want no bridges. He ain't want no crowns. He ain't want no fillings.
Well,
He was
listen,
like,
look, when you ain't been to the dentist in 15 years, I don't know what difference another day is
wait,
going to
he ain't
make.
been, he hadn't been in 15 years?
But yes, he hadn't been in 15 years. So another day,
So
you
he
be
must
straight.
have had like,
You be
he just
all right.
had all his nerves was like, oh, I'm here and we getting this done today.
I guess. I don't know.
Oh
Listen,
my
I just heard
God.
fussing. I was